afternoon, everybody. This is Kim Russell, and I'm the Navajo Department of Health Director. Happy to be here with you all on another Lunch and Learn on the President's Facebook Live. The President's Facebook Live gets a lot of traffic, and it's really happy to be providing presentations to you from the Department of Health. I believe this is going to be our fourth presentation from the Department of Health, and we're really happy to provide, a focus on his page in terms of health and wellness. And so today, I'm really happy to present to you a topic that I think a lot of us are familiar with, and that's a topic on focusing on preventing diabetes and just overall wellness. And our presenters are going to be coming from our really, really great and awesome Navajo Special Diabetes Program. You've probably seen them out in the community many a times. They're a part of our wellness centers, and they just do a lot of good in our communities. So I want to, I think this is really exciting for me. I was talking to the staff, and I used to do this work in my prior career. I used to be a health educator. I used to work with staff who wanted to get their certification so that they can be fitness specialists. So really happy to be introducing to you some really, really awesome gentlemen. We have two gentlemen that'll be presenting today, and you might have seen them in community. I want to introduce first Mr. Garrett Sosi, and he's a fitness specialist at Delcon. He'll be presenting on physical activity. And then Mr. Sosi will hand it off to Mr. Justin Shorty, who is a Shiprock health educator. He'll be speaking to you about the ABCs of heart disease. So gentlemen, take it away. Really happy that you're here to join us today. Thank you.
All right, thank you. Good morning, everybody. My name is Garrett Sosi. I am a fitness specialist. I work at the Delcon Wellness Center under the Navajo Nation Special Diabetes Program. I've been here in Delcon since September of 2023. Prior to that, I worked with the same program, but in Shinle, also as a fitness specialist. So my clans are Asche Nishla, Tatsani Bashichin, Sanjikene Dashiche, Kazakane Dashino. And like I said, I'm originally from Shinle, so presentation I'm going to go over today is over the basics of physical activity and how it, in general, some of these things you might have heard before, but some of them I did my best to relate to us. We have a very unique lifestyle here in the Navajo Nation, so I did my best to translate that over. So just my information on the first slide here. If you guys have any questions, these are how I can be contacted either by phone or email. First slide, we're going to go into, I can get it to switch like this. Okay, so what is physical activity? Basically, it's just any activity that involves movement. Most of us think of running, lifting weights, people who do more specialty type of lifts like CrossFit, powerlifting, other people do Zumba, yoga, Pilates, those type of things, but really just anything that involves movement. If I just stood up in my chair right now, that could be considered a physical activity. If I go out to the gym floor and start cleaning or start lifting weights, that's also a physical activity. But overall, we recommend at least about 150 minutes per week. That's a bare minimum. You can always do more, just depending on your physical capabilities. There are some different recommendations for different age groups. Anyone who is younger, 6 to 17, it's a little higher. It's about 180 minutes per week, but generally, we go about 30 minutes a day, at least 3 to 5 days per week at a moderate intensity. Like I said before, it can be more, just depends on what you're physically capable of. So, benefits of physical activity. These are some of the basic ones. There's others that I hear a lot with people that come into our facility, but overall, just optimal growth of your heart, your cardiovascular system, your lungs, pulmonary, increased strength in your muscle, bones, tissues, for females, it's strongly recommended that they have some form of weight-bearing activity in their physical activity plan, just to prevent things later on down the line like osteoporosis. So another one, maintain healthy body weight, body fat. That's probably the number one thing that I get as a fitness specialist is, they want to either maintain or increase muscle mass, but also reduce fat mass. That's probably the number one thing I hear when people come into our facility. But overall, improve, muscular strength, endurance capabilities, aerobic capacity. Physical activity is a good way to reduce stress, usually mental stress. But overall, physical activity is a form of physical stress that we put on our bodies, and the more your body adapts to it, the more of that physical stress that it can tolerate. Improving psychological well-being and self-esteem kind of goes along with the stress part that I just mentioned. Also lowers your risk for heart disease, diabetes, as well as certain types of cancers. And overall, I think most people will notice, if you do at least one workout, you'll feel like you have more energy afterwards. So that's another benefit. This part is more on my end as a fitness specialist. When I get a new person I'm going to work with, these are some of the things that I first ask them, and it's all questions. I think some people would come to a gym and they want answers, right? But I present more questions so I know which way that I can take them. So overall, when you come into the gym, you want to have a plan, be prepared. So these are what I would ask you is, why are you going to start? What's your overall goal? When do you plan to start? Is it right now? Is it in a few months down the line? What are you going to start with? Do you want to get into like basic weightlifting, running, hiking? What's your plan? How are you going to start? Are you going to start alone? You're going to start with, a friend, family member. You're going to work with, myself as a trainer. And where are you going to start? Are you going to start in a gym, outdoors, at home on your own? And this kind of relates to what I said before, but who you're going to start with. You're going to bring someone in with you, your relative, coworker, whoever. So just so you kind of have a general idea of where you're going. So this first part, where to start, I don't know how many of you have heard of SMART goals. I've heard it so much since I was in college. It might be kind of a redundant thing to talk about, but it is a really good template to kind of get yourself started with not just physical activity, but it can be applied to a lot of different things. And that's why it's always out there. But SMART goals standing for having something that's specific, measurable, achievable, relevant, and timely. So if I have someone that comes in, their goal is to, let's say, run a marathon. Okay, that's a specific goal. A marathon is a specific distance that they want to run. So my next part that I would look at is measurable. Yes, it's measurable. It's a distance that they do have to run. Achievable, is it achievable to that person? Are they giving themselves enough time to prepare for it? Are they doing the proper things to strengthen their body to get them there? If not, that's where I can step in and help them as well. Relevant, how relevant is it to their overall goal? Maybe just the marathon might be their top goal, their very long-term goal at the very end. So leading up to that, we might include, starting them in some 5Ks, increasing to 10Ks, half marathons, and then, we kind of track it as we go along. And timely, do we have enough time for this goal? Running a marathon is no easy feat. I think anyone who's ever done one will definitely tell you that it's not an easy thing to do. It takes a lot of time. But overall, if you have that as your goal, you do definitely want to have enough time to plan for it. So if there's anybody that has any questions, I know I can see some of the comments here. Specifics, you can ask some questions. I'll do my best to answer them as I go through. But, like I said, this template is very broad, but, someone like myself, I'll do my best to help and break it down and simplify it as best as I can. So next one. Even though this is kind of toward the mid part of my presentation, this is probably the very most important part of the whole thing, is safety. So if I get someone that comes in my gym, they want to start being physically active, I have a packet that I give them that they sign in with. And the main purpose of that packet is not just to get, information from you, but relevant information to what you're about to do, which is engage in physical activity. So if you have any of the following issues listed here, like you have high blood pressure, recent surgery, operation, heart attack, stroke, those types of things, I really need to be aware of this before we start engaging in physical activity, just because, like I said before, it's a physical form of stress. You have any one of these issues here, then that'll present some roadblocks down the way, just to where, if we start really stressing out your cardiovascular system, your lungs, we don't want to cause further injury if you already have issues in those areas. If you have knee problems, back problems, we really got to monitor those things. And overall, our program, Navajo Nation Special Diabetes Program, we really look out for people who are at risk for diabetes, if not if they currently do have it. And in those cases, really do want to monitor sugar levels if they're engaging within a facility of ours or out, especially this time of year, it's pretty hot. So we got to take into account environmental factors as well. But once we get doctor's clearance, if needed, for any one of these issues, then we can proceed kind of using that doctor's clearance as a template for intensity. Okay, I think a lot of people think that when they come into the gym and work with someone like myself, is that I'm going to really push you. In most cases, I do, but it's always different for everyone that I train. Everyone will start at a different level of intensity, and then we progress it from there. So don't be afraid of us. This one's a little more based on anatomy for muscles, but overall, just the basic part of this slide that I want to convey to you guys is the different types of muscle fibers that we have in our bodies. We have a slow twitch, a fast twitch. Slow twitch is more for things that are at a lower intensity but for longer duration. So I used an example before of a marathon training. So that would be considered a slow twitch type of event. Versus fast twitch, right now, Olympic trials are going on, so you're seeing a lot of sprinters out there. That's more considered like a fast twitch, something that only lasts a few seconds and then you're done. So it can be sprinting, it can be powerlifting, those types of things. And our bodies, they're very adaptable to either one. If you lean more towards slow twitch training versus fast twitch, that's fine. There's kind of a middle ground that our bodies can do, but if you're really trying to focus in on a type of physical activity you want to do, you really do have to focus on either or, okay? Because if your goal is to run the marathon, you probably don't want to be doing 500-pound deadlifts on the deadlift platform, okay? That would really serve no purpose to your marathon goal, okay? So a little in depth with the anatomy if you look at some of these slides, but just overall, just know there's two types of muscle fibers, fast twitch and slow twitch. Any specific questions about them, just let me know. I put my contact information on the very first slide. So if you have any specific questions, I can be contacted later. But next one, kind of getting into some stuff I touched on before, is different types of training. Some common ones that you hear are like CrossFit, high intensity interval training, functional strength training. Some examples of cardio training here on the side: running, bike riding, swimming, hiking, walking, Zumba. If you guys do sports, these are pretty common ones you hear a lot of. However, I put on another slide here some things that are unique to us as Navajos living on the reservation, or even if you live off reservation. So you want to use, work with what you have. If you don't have squat racks, dumbbells, anything like that at home, if you see any of these pictures here on this slide, you'll know that all of these things involve strength, involve patience, technique. So if you have livestock, you got to transport them, you have to haul water, hay, you have sheep, cattle, you got to herd them, you got to shear them, brand them, ear tag them, butcher them, But, these are things that do take a lot of time, a lot of patience, especially in this time of the year when it's very hot out. Vice versa, in the winter time, we got to haul wood, we got to chop wood. So like I said before, this is any kind of movement is considered physical activity. Okay. So this is what's unique to us here on the Navajo Nation. Making time to be physically active. I think this is one of the main roadblocks that I hear from people who want to be physically active, but they just always say, I don't have time, I have my responsibilities, I have work, school, those types of things. But always best to try to designate a time of your day, whether it's early morning, lunch, after work, weekends. Try to include people around you, family members, friends, co-workers. You always want to have that accountability, not just to yourself, but with other people. You're always going to be busy. Understandably, if you have a long commute to and from work, what do you do at work? If you're in an office setting all day, try to do something. I've done presentations in the past where I've done, chair exercises with people. Just even if you're just stuck in your office all day in your cubicle, you can do some stretches, just something to apply some tension to your muscles, your joints, your ligaments. So it's always best to invest in your health, because you always hear the saying, it's kind of a generic term now, but if you don't use it, you lose it. So always best to invest in this. Again, I talked about safety before, same applies here. Always begin slowly, avoiding injury. You want to know what you're capable of, especially if you haven't exercised in a while. If you're brand new to it, start low. You need help from someone like myself, we can help you with that. You want to keep it as safe as possible. If you're doing running, if you're going to do weightlifting, or even if you're going to go out and herd sheep all day, shear them, if you're going to haul water, you best to have like some kind of warm up, cool down. If you're going to stretch, walk around a little bit before you get going. You have your foam roller at home, something like that, massage gun. Those are good things to help out with. And always best to listen to your body. Your body's your best indicator of what you can handle. Maybe if you notice you feeling dizzy, feel lightheaded, maybe something like your back hurts too much, really listen to what your body's trying to tell you. You don't want to push it too hard. Overall, for tips for exercise, you want to keep track. If you forget, what you did on Monday, you don't want to duplicate that like on Thursday or Friday later in the week. So always best to keep like a log of I lifted this much weight on this day, I ran this far on this day, and always make sure it matches up with what you're doing on your nutritional side. And my coworker Justin's going to delve more into the nutrition side in his presentation when he comes up. So if you have access to it, a lot of us have, the fitness trackers now on our phones, our watches. Those are good ways to track where you go, how far you go, those types of things. Always best to choose something you enjoy. If you don't like running, don't make yourself run. You can hike, you can ride your bike. If you have access to like a community pool somewhere, use that. Make goals for yourself. If your goal is to increase the weight you're lifting, do it in a progression. Maybe today I can only squat 135 pounds. Maybe in 6 months I want to be able to double that. And then track how you get to there. Again, we talked about setting time aside for exercise. That's always a good way. I mentioned before, slowly increase intensity. It's kind of cut off here, but slowly increase your intensity. Always have a challenge for yourself. And always make sure, again, that with the nutritional side, that you're eating things that are nutrient dense and that will benefit your physical activity, physical goal for yourself. For my presentation, these are some of the resources that I use for our intake process. If you come into our facility, we have a packet that you sign. It falls under the American College of Sports Medicine guidelines for what we look for risk assessments for your health, those types of things. So that's what I used here in this presentation. I found a couple articles online. So these are the links for them. This presentation I created about 2 years ago, and it's been refined. Some information's been updated since then. And this last page, I want to thank you all for your time sitting in. I hope you learned something. It is a very broad presentation. If you ever come into our facilities, I can definitely break it down in more detail. But our next presenter, my coworker Justin, he's going to delve more into the specifics on diabetes education and nutrition. So thank you for your time, and Justin, it's all yours.
Unmute. Yat she'e Justin Shorty Yenishe do ma'idashkijni nishlanto zana bithlin bashichin ado tachitni dashiche do hashklishni dashinella. I work under the Navajo Department of Health as a health educator with the special diabetes program. I am based out of Shiprock service area, and right now I'm presenting from Tisnas Boss Wellness Center. Our roles are very similar, Garrett and I, in that we try to provide a lot of preventative education and working with people either through group or one-on-one sessions. And it's very important to be mindful that prevention does work, and that any efforts that a person does to improve their life, whether it's taking 5 to 10 minutes out of their day to recenter themselves, to reduce your stress, does have positive impacts on their health. And today's topic, I am going to be focusing more on heart disease. It is a very heavy topic. Just as a disclaimer, this is all purely educational, and any medical advice that you are seeking, please speak to your doctor and make time for yourself to take care of yourself. And so here we quickly see the ABCs of heart disease, and this is purely talking about prevention. And with our curriculums that we choose, we go with the Association of Diabetes Care and Education Specialists, and what we emphasize are self-care behaviors. So I understand that many people view health concerns as a personal and private matter. That doesn't mean that there's no support available. And so by providing education, just even knowing some of the signs, the risk, and what can be done is another part of taking care of yourself. So reducing risk is just one topic out of 7 different topics that we can provide education on. And so without further ado, the ABCs of heart disease. So, and for the upcoming presentation, I'll be talking about heart disease risk, what is known, and then briefly go over some diabetes education. And then we're going to learn a mnemonic, ABCS, ABCS. A for A1C, your average blood sugar or glucose levels, B for blood pressure, C for cholesterol, and S for smoking. So an overview for cardiovascular disease. Heart disease is just one part of cardiovascular disease. And back in 2020, the American Heart Association released a statement that really tried to simplify how heart disease risk is affecting a lot of American Indians and Alaskan Natives. So we know that the problem is that heart disease is very prevalent in many of our communities. And what is known is that diabetes is still the #1 leading cause of heart disease to develop within people, followed by LDL cholesterol, which is known as a bad form of cholesterol, hypertension or high blood pressure, renal disease or kidney disease. A person's biology, their biological sex does impact their risk for heart disease. Age, unfortunately, as we get older, we can't turn back time, so everything in the body ends up catching up. And on top of that, it's very difficult for people to be more open about their own personal health concerns. It's usually until the very last minute when things are really starting to show is when they drive themselves to the hospital. So being sure to be consistent with annual checkups and screenings with your doctor is very, very important. And also, there's still the issue of tobacco. And this doesn't pertain to ceremonial tobacco. It's pertaining more to tobacco cigarettes that you find in gas stations or convenience stores. And it also refers to smokeless tobacco like chew or skull. And then on top of that, with diabetes itself, and it's not just focused on just the person as an individual, everything within their environment can affect their health as well. Toxic metal exposure, such as prolonged, meaning years and years of exposure to mercury, lead, cadmium, and arsenic, has been found to increase the risk for heart disease. Even a person's income, because it's very difficult within our communities to get to the clinics or to the hospital to get screened. And oftentimes if people don't have adequate transportation or the money to see specialists, it can be very harsh on them and hard on them under health. And of course, there's always the issue of discrimination. Sometimes if a person doesn't feel comfortable speaking about what's bothering them, it can really hinder their ability to seek out support. And so ultimately, all of these things, they tend to increase the risk of heart disease within a lot of our communities. And since we are with the diabetes program, over so many years, many of the health educators that came before me and nutritionists, they really tried to ground down this idea that diabetes is a 24/7 health condition. And ultimately, what we're looking at is blood sugar. And with blood sugar, it can vary depending on many factors. As Garrett was mentioning in his presentation, physical activity is just one part of the conversation, but blood sugar is impacted a lot by different things in a person's life. So with diabetes, it's not, a severe condition. It can be managed by changes in a person's lifestyle. That's why with our program, we really try to do a lot of outreach, and within our own wellness centers, we encourage daily exercise routines. And, for many people, if they're not yet comfortable at that stage, simply walking for 30 minutes in a day and slowly increasing to about 150 minutes per week is a great way to start. And on top of that, intensity does matter. As Garrett was mentioning, getting an idea of where you're at right now and pushing yourself further, it will only improve. And on top of that, eating habits do play a huge part in it. For many people, especially for myself, it can be very difficult to keep up with eating habits. Ideally, we want to have 3 meals a day with snacks in between. But for many people, it can be very difficult for them to have breakfast in the morning, especially if they're on the road or on the run, or even during lunch times. If you don't have enough time, sometimes you have to just find whatever is convenient. We're not here to just punish you for that. We're here to try to work with you to develop these positive eating habits. And ultimately, if these preventative methods like exercise and eating doesn't show any effect on blood sugar, that's when the hospital, can start prescribe different forms of medication. One of the most common forms is metformin, and what's growing in popularity is Ozempic. It's marketed as a weight loss drug, but it's still an anti-diabetic medication. And then there's insulin as well, because sometimes for people, their own organ, which is the pancreas, isn't producing enough insulin. So they have to receive insulin shots in order for their body to break down sugar inside their body. And what is known is that the long-term effects of high blood sugar levels can impact a lot of the organs inside the body, such as with the brain. It can cause a lot of mental issues, loss of consciousness, concentration, and for more severe outcomes, stroke. It can even cause eye disease. One of the earliest signs a person can know if their eyes are being affected is blurry vision. It can lead to cataracts, glaucoma, and eye disease. And on top of that, heart disease. That's another thing that we'll be talking about for the rest of this presentation. And of course, the pancreas, it can affect the pancreas. It can lead to a lot of health outcomes with that, to where it doesn't produce enough insulin, or maybe the insulin that is being produced doesn't work within the body. And so it can also affect the stomach, leading a lot of these discomfort symptoms like heartburn, nausea, vomiting, or bloating. So all of those, they are heavily influenced by how elevated a person's blood sugar levels are. And then for many people, frequent bathroom breaks, blood sugar does affect the kidneys and causing it to work overtime just to filter out all of the fluids. And then for skin health, it can lead to increased risk for bacterial, fungal, and yeast infections, because it's a lot harder for the body to heal itself if the blood sugar levels are too high. And so, blood, it travels through our veins. And if you think about your veins as a nutrient highway, and blood sugar, if it's taking up a lot of space on that nutrient highway, it's a lot harder for the body to repair itself or to provide a lot of the good nutrients to different parts of the bodies. So that's where damaged blood vessels and high blood pressure starts to develop within a person. And then ultimately, with the feet, a lot of times people talk about tingling or numbness in their feet. And that's because high blood sugar levels can affect how well the body signals across the body. So we know that blood vessels, they carry nutrients to all the organs inside the body, while the nerves send signals to this different part of the bodies. So simply just by rubbing your hands together, that sensation that you're feeling if you're holding something warm or hot, all of that sensation of the heat is going through your nerves and being sent to your brain. Now for blood sugar, if it's very high, it can impact how well those nerves function. And that's where a lot of that peripheral neuropathy develops. And with that one, it can be lead to a severe health outcome if the blood sugar levels aren't brought down to a normal or safe range. And so when we think about reducing risk, there's short-term risks. These short-term risks, they can be corrected within a day and over time, which is low and high blood sugar levels. You know, if you have access to a glucose meter, you can check your blood sugar levels in the morning. If it's high, that's probably an indicator that your body's not properly resting. Or maybe if it's too low, that's a sign that you need to get some food in your system. And macrovascular or large blood vessels and microvascular or small blood vessels, those diseases are long-term, meaning it doesn't develop overnight. It takes a very long time for these diseases to develop. And that's where, you know, cardiovascular disease like stroke, heart disease, and other issues with the blood vessels. And microvascular are diseases that are affecting organs, you know, kidney disease, eye disease, and nerve disease. And then a lot of times when it comes to diabetes, it can start to affect a person's ability to sleep properly. Sleep apnea is another indication, you know, of elevated blood sugar levels if they're not managed in moderation. And it can even lead to hearing loss as well. Yeah, and so I'm just reading a comment from the chat about diabetes. Yes, diabetes, what is known is that it can increase the risk for heart disease, but heart disease ultimately is caused by many other factors. They just found that on a lot of American Indian and Alaskan Native communities, diabetes is still the leading cause for a high risk for developing heart disease in our communities. So that's why we keep emphasizing, you know, practice a lot of healthy behaviors, like making sure you're getting enough exercise and finding time to take care of yourself when you're eating foods. Those are all ways to prevent, while specific things that I'll be talking about are things a person can do when they go to the hospital, or even if they need help with finding questions to ask their healthcare provider, they can always reach out to the wellness centers or any of our offices. So the first step for preventing or reducing a risk for heart disease is A1C. So A1C is a person's average blood sugar levels for about 2 to 3 months. So if you haven't checked your A1C this year, and if you go in for July, you'll be able to know your blood sugar levels from April to June. And the thing about A1C is that it fluctuates over time. And these A1C blood tests can only be done by a hospital or clinical, by your doctor. And of course, with A1C, repeated tests are necessary. So for example, if someone came went to the hospital to get their A1C, and it was like close to 6%, they would need to give back to the A1C is that it has to be done. You can't yourself, and that's where that whole cannot be self-diagnosed comes into play. And so when we look at your A1C and the blood test, all that it's looking for is how much blood sugar is still within your blood vessels and how well your body is breaking down that blood sugar. So in the diagram, we see these bubbles where on one side, there's these red circles or blobs, that's your blood cells. And then there's these white blobs, those are signs of like blood sugar. And so when a blood sugar starts to increase heavily, it can cause that, you know, that traffic jam that I talked about in earlier sessions, where it's making it more difficult for a lot of that nutrients to pass through the blood vessels. And so this example right here with our graph, that's just showing what it would look like for someone to have elevated blood sugar levels. Oftentimes, people's blood sugar levels can range up to 500 or even up to 700. 140 is where the line is for people on whether or not their blood sugar levels are high or low. And so we can see that having a regular meal pattern throughout the day can cause these blood sugar spikes. But if that pattern starts to become irregular, where it's consistently staying spiked, that can affect A1C. And if A1C isn't managed, it can finally be diagnosed by the doctor as diabetes. And now, for the next step for prevention is B, blood pressure. So blood pressure, there are many things that can influence the readings in it. Reducing risk, caffeine. If you're a heavy caffeine drinker, that can increase your blood pressure, but over time it will decrease as the caffeine leaves your body. So that's why we really emphasize with energy drinks that, it shouldn't be given to children because it can cause their blood pressure to increase rapidly, which can increase their risk for many severe health outcomes. And on top of that, blood pressure, it can be brought down into a safe range by, maintaining a healthy weight. It is known that at a person's current weight, if they lose about 5% of that, it can really reduce their risk for heart disease. And then on top of that, if a person is on medication, taking prescribed medication as noted by their doctor is important. And it's always good to take it every day, even if you feel okay, because that medication is helping to make sure that the blood pressure doesn't greatly impact other parts of the body. And so in general, with health tips for maintaining blood pressure and helping to bring it down is to increase your fiber intake, choose whole foods, whole fruits, whole vegetables. We're coming to harvest time, so a lot of summer squash, naize, is very good to invest in because, it's low in fat. And then on top of that, being mindful of your sodium intake, because it is recommended that a person reach, a maximum of 2,300 milligrams of sodium on a daily basis. And so that's roughly equivalent to about a teaspoon of regular table salt. So if you're getting about a teaspoon of table salt added to your food, that's where you need to cut it off, because any more can influence your blood pressure. And then some quick facts about blood pressure. I like that Garrett mentioned, muscle fibers, because they do play a role in blood pressure as well. But with blood pressure, all that we're looking at is how hard your heart is working to push blood throughout the body. As you can see, in the first on the image under A, the blood vessel isn't being squeezed, so it's sitting there. But when your heart is contracting, when you feel your first heartbeat, that blood gets pushed out and it goes throughout the body. So that's a constant thing that's going on right now inside your body. And so how well your heart is pushing out the blood and when it's relaxing is how we get blood pressure. And so with the blood pressure categories, if you haven't had your blood pressure taken lately, it's good to get back into the hospital to check. Normal levels are between 120 over 80, but when things start to get higher, that's when, it's important to be more mindful about how you are being active and the types of food that you're eating. And it, like similar to the A1C test, repeated blood pressure tests are needed to make before a diagnosis can occur. And so with this, hypertension, there are different stages to it. There's pre-hypertension, and anything that starts to get above that range, that one will require a lot of medication to reverse it, to make sure that the person doesn't suffer from like a heart attack or any other cardiovascular diseases. And now for C, for cholesterol. So with cholesterol, there are good forms, there are bad forms, but in the end, this cholesterol is important for the body. It can also be known as blood fats, and it comes from different types of foods, and it's also coming from the liver as well. And cholesterol, it's important because it keeps your blood vessels healthy, but too much of cholesterol, it can cause plaque formation to develop. And this plaque formation can influence a person's blood pressure. And in severe cases, it can cause a complete blockage. So right here is an image of the heart muscle and the impacts of plaque formation from too much of the bad cholesterol building up in the blood vessels. So we see that, that highway, it's blocked off. So that means no nutrients, even blood sugar, isn't able to get across different parts of the body. So with this one, cholesterol, it takes time for it to build up inside the body. And if you're curious about where your cholesterol readings are, the hospital can provide a blood test once every year. And for many people, if they are actively changing their lifestyle habits, it can take about 3 to 6 months for them to see any changes in their cholesterol levels. But once again, accurate cholesterol readings, they can only be done once a year, depending on your hospital. And then here is a breakdown of the different forms of cholesterol. So earlier in my slides, I mentioned LDL cholesterol as being a bad form of cholesterol. So we know that that cholesterol is mainly coming from saturated fats. And you can think of saturated fats as any fats that are coming from animal-based products like milk, different steaks, ground beef, chicken, pork, lard, shortening, butter. Anything that's produced by an animal or comes from an animal will have saturated fats. So in order to reduce these saturated fats in the body, it's good to really consume foods that are high in unsaturated fats. And that's why with a lot of our food demonstrations that we do, we try to emphasize using different cooking oils because these oils are high in unsaturated fats. And that's just a way for a person to help build up these healthy forms of cholesterol in their body so that it can regulate the other forms of cholesterol. And finally, S, prevention, smoking. What is known is that the nicotine in a lot of tobacco products does alter the chemical functions inside the brain. For many people, it's a great stress reliever, and that stress relief is just a byproduct of the nicotine constricting blood vessels. So in our image, we see normal blood flow. The hole is a lot wider, meaning the traffic of nutrients and blood sugar is able to pass by without being bothered. But with nicotine, what it does to blood vessels is it causes it to tighten. So that tightened blood flow makes it harder for nutrients to pass through. So that's how smoking can contribute to elevated blood pressure levels. And now when you think about it, all of these things that I talked about, your A1C, blood pressure, and cholesterol, if all of these things are out of balance, it can end up leading to a lot of severe health outcomes. And on top of that, with smoking, it's not only affecting the blood vessels, it's also damaging lung tissues and airways, which can lead to, increased risk of like asthma or chronic obstructive pulmonary disease, which is COPD, and even lung cancer. It can damages a person's DNA, which, can lead to lung cancer, can even affect their hearing and even affect their vision as well. So with health effects of smoking, it's a lot of major damage to a person's internal organs. And the rule of thumb with this one is that it's causing these blood vessels to tighten, which is only going to affect blood pressure. And if a person has high cholesterol levels and that blood pressure is being and their blood vessel is being constricted or tightened, it's only going to force the heart to work harder. And if that blood pressure and that blood is impacting a buildup of plaque inside the body, it can cause that plaque to break off. And that's how a person develops blood clots. And that blood clot can either completely block off that blood vessel, or if it's small, it can travel throughout the body and get stuck somewhere else. So that's why it's very, very important to keep up to date on your health statuses and being sure to, practice the ABCs of heart disease. And so in summary, it is a very heavy topic, but that doesn't mean there's no way to prevent it. With heart disease risk, daily exercise and regular eating habits can lower or even prevent heart disease in many people. And with diabetes, if you've been diagnosed, it's not, there's still hope, you can manage it. And for people who are at high risk for developing diabetes, having a good exercise routine and taking care of yourself is the best way to prevent it. And on top of that, with diabetes, it's a 24/7 health condition. And with that one, high levels of blood sugar does affect the whole body. And then just quickly going over the ABCs, A1C. If you haven't done a blood test with your hospital, do make time this year to get it done so you know where you're at and you can start exercising and changing your habits to improve your health. Blood pressure, the hospitals can do it, or even if you're in contact with your community health representative or CHR, you can always reach out to them. They're always present at some health fairs. They can do blood pressure checks as well. And then cholesterol, it's very hard to avoid a lot of fats. So in general, try to choose foods that are low in fat or fat-free. That's the best thing that a person can do to help their cholesterol levels. And then smoking, make plans to stop if you're already smoking or don't start. And so that's what I have to present today. And as Garrett has showed, we do cite a lot of our sources from evidence-based curriculums, and that is what I have to present for today. With this comment in the question, any tobacco product that has nicotine in it is going to affect blood vessels. So regardless of how it's, if it's smoked or if it's smokeless tobacco like chew or snuff, if it has nicotine in it, it's going to affect blood vessels levels, blood vessel as well. And so, that's the end of my presentation for today.
Thank you so much, Justin and Garrett, for your presentation on behalf of Navajo Department of Health. Special diabetes is one of the 13 programs under the Public Health Services Division here at Navajo Department of Health. Navajo Department of Health encourages each and every one of you out there in the Navajo communities and the World Wide Web to continue to work towards a good health with good mental health and good physical health. We encourage each and every one of you to take time out of your day and make it a priority to exercise and make it a great day for each and every one of you. We look forward to having another lunch and learn and being a part of this again next week. We are looking towards offering some great giveaways, hopefully to each of our viewers. To encourage more viewers to come and learn more about yourself and the standards of health for each and every one of us. Navajo Department of Health is strongly promoting hashtag Navajos Healing Navajos. Thank you for having us and have a good day. Thank you, OPVP, and a shout out to Kevin and the team. My name is Sherilyn Yazi. Hashkahadzon Shlon Kiani Bashashin. Hatsoa Dashanella Hashlishi Dashache Ehud Aden Goodbye.